Hey, so these are my top tips for anybody who's taking care of prisoners inpatient. Okay, so I was an ICU nurse for a long time. I worked in Baltimore. We had patients from the Baltimore Supermax in some very violent areas of the city. So patients that were prisoners and shackled was pretty common occurrence in some of the facilities that I've worked at, especially like rural hospitals. A lot of times they do get the patients from the prisons out there, so I just wanted to go over some things from a nurse perspective that I think are important, along with bringing in some of that security knowledge that I have developed over the last couple years. So one of the things to remember is that a lot of times patients who are prisoners have a history of mental health crises. They may have been former addicts. Those are folks that we know notoriously have issues with communication, with ability to adhere to the law. So, somebody who has a psych or mental health issue or diagnosis may have trouble following societal rules, right? So, and that can be for many various reasons, but we need to keep that in mind when we approach these patients. So, I always say that keep in mind that everyone's story is unique. In nursing school, you're really taught not to judge folks, not to think about, it's not appropriate for you to know what they did, blah, blah, blah. It is appropriate for you to know what they did if it has something to do with the risk of you being a victim. Okay. So, one of the number one things I like to look for is tattoos. Any type of tattoo that is identifying them as being part of a gang, identifying them as being, in a group of people. If you can try and figure out what rank that they are in that group of people just by tattoos, I do not recommend you asking them, be like, hey, are you a shot caller? Like, are you high up in the Aryan Brotherhood? Like, do not start those conversations, okay? Like, don't do that. Don't ask those questions, but you can observe by looking at their skin. And if they do have indicators of that, that's definitely an appropriate time to collaborate with security officers. Now, when you go to the security officer and the security officer says, "Okay, so what?" That tells you that they just don't have the education that they need to understand why they would want to be worried about someone who potentially has gang affiliated tattoos. That could be just like we saw in that case in Idaho where the person faked that they were hurt or self-harmed in order to get out of prison, right? And then they had a plan and they met some folks there and there was this whole big escape thing, right? Well, he was part of the Aryan Brotherhood, which is clearly identified by visual tattoos on the face and the hands and different areas. So I know that at some hospitals that I worked at in the city, we have a binder with the different tattoos, and that was just so that we make sure that we wouldn't put rival gang members on the same sides of the trauma unit, right? So those are things that we can look at, and there are particular gangs that will be popular in that area, but they should actually know from the prison. Those guards should know, like, hey, they're affiliated probably with this because they all hang out in the groups together in the prison, so they'll know. So that's something that piece of information that you can pass off, to just let them know, there's a potential that they could have affiliating friends in the environment, and if they're going into the emergency room or they're going into an area that may be an open bay, just keep that in mind because they will at any opportunity um, instigate one another or start a confrontation, even if they are truly very sick. The next piece of that, when to determine whether your patient is very sick or when your patient is not so very sick. I will tell you a story. I had this patient who was a prisoner. Now, I was in the cardiac ICU. So these patients usually have heart failure, they're dying. This young man, and I say young because he was only 33 years old. This young man had been a prisoner. Not sure what he was in prison for, but they did keep him shackled the entire time. And that's one of the things that I'll notice. Like, they'll be like, oh, he's fine. He's never been a violent offender. And they unshackle him. Well, that's okay. He's been fine in this moment, but like, who's to say that he's not a sexual offender? And I'm a woman now coming into this environment, and those are things that, like, I feel like as a nurse, it would be helpful to know so that we can provide care safely. And it's not till after someone's groped or after someone's sexually assaulted that then we get the message that, oh, you should approach this guy with two people, or he should have a male nurse, or, what are the things that we can do to mitigate those type of things? We don't find out till afterward. So definitely finding out that from whoever's sitting with the patient or the prisoner. Um, the professionalism that needs to maintain for those officers. There have been many times when I work night shift where I walk in the room and the officers are asleep. And it is because they pick up overtime shifts to pay their bills, and I get it, and that's great. But when we are in the room and it's dark and we're trying to provide rest, we need to make sure that patient is shackled. We need to make sure that we're not sitting close enough to where the patient can get a hold of your weapon. There's so many opportunities. 1 in 4 shootings in an ER happens because someone gets an officer's weapon. So weapons retainment training, making sure that you guys are alert and paying attention, and that if you as a nurse go in the room and you see the officer asleep, wake them up. Wake them up. Like, don't be like, "Oh, he's asleep." Wake them up. Okay? Because they are there ultimately to do a job, and it is terrible that they're tired, and I do feel bad for them because who hasn't gone in the break room and shut their eyes for 20 minutes? But we're not there to guard. Okay? And that's the other thing. Stop making them do 12-hour shifts of sitting inside a hospital room. That's terrible. Like, can you not break up the guard shifts or have like a relief guard come? Or I don't know. There needs to be something better. And maybe that's like a collaboration with security thing. I never see security officers rounding on patient prisoners. Like, if I was a security director, I'd be like, yo, you've got a prisoner inside of this hospital. You need to round on them every hour or more frequently, depending on what the situation looks like. So, for the gentleman I had in the CICU, he was so sick that like he was not going to get up. And even if he tried to get up and move, he couldn't, like his heart was failing and he ended up dying like 3 days later. So I had them like unshackle him. But that was one of those instances where there's a fine line between like compassionate care and then also having rules and regulations. So if you are interested in more information about taking care of patients as prisoners, let me know. We're offering a training and we'll be happy to help you. Bam.